Hey there, and welcome back to our channel. If you're new here, make sure to hit that subscribe button and turn on notifications so you never miss an update. Today, we're diving into a topic that affects millions of people worldwide, but often goes undiagnosed for years: small intestinal bacterial overgrowth, or SIBO. We'll be breaking down what it is, the symptoms, its causes, how it's diagnosed, and both conventional and natural treatment options. Stay tuned to the end for a list of highly effective herbal remedies. So, let's get started. Hi everyone, I'm Tara, and today we're going to talk about this growing condition. If you've been dealing with unexplained digestive issues, this video is for you. Let's start by understanding what it actually is. SIBO stands for small intestinal bacterial overgrowth. It's a condition where there is an abnormal increase in the number of bacteria in the small intestine, especially types of bacteria that are usually found in the colon. This overgrowth can interfere with the normal digestive process, leading to a variety of symptoms. So, what are the symptoms? They can be quite diverse and sometimes confusing because they overlap with other digestive disorders. Common symptoms include bloating, abdominal pain, diarrhea or constipation, gas, nausea, malnutrition, unintended weight loss, and fatigue. These symptoms can vary in severity and can be persistent or come and go. Now that we know the symptoms, let's talk about what causes SIBO. There are several factors that contribute to its development. Some of the main causes include structural abnormalities in the small intestine, such as adhesions or strictures. Motility disorders, which slow down the movement of food and bacteria through the intestine. This can be caused by conditions like diabetes, scleroderma, or even certain medications. A weakened immune system, which can fail to control bacterial growth. Low stomach acid, which can result from chronic use of proton pump inhibitors, PPIs. Previous surgeries, such as those involving the bowel, can also lead to SIBO by altering the normal flow of the digestive tract. Diagnosis can be tricky because its symptoms are similar to other digestive conditions like irritable bowel syndrome, IBS. However, there are specific tests that doctors use to diagnose SIBO. The most common diagnostic test is the hydrogen and methane breath test. This test measures the levels of hydrogen and methane gases in your breath after consuming a sugar solution. Elevated levels of these gases can indicate bacterial overgrowth in the small intestine. Another method is a small bowel aspirate and culture, where a sample of fluid from the small intestine is collected and analyzed for bacterial content. This test is more invasive, but considered the gold standard. Once diagnosed, the next step is treatment. Conventional treatments usually involve antibiotics to reduce the bacterial overgrowth. The most commonly prescribed antibiotics for SIBO are rifaximin and metronidazole. These antibiotics are chosen because they stay mostly within the gut and have minimal systemic absorption, which helps reduce side effects. While antibiotics can be effective, many people prefer to explore natural treatment options, especially for managing and preventing recurrence. Let's look at some natural approaches to treatment. Natural treatments include herbal antimicrobials. Certain herbs like oregano oil, berberine, and garlic have antibacterial properties and can help reduce bacterial overgrowth. Diet modifications. The low FODMAP diet or the specific carbohydrate diet, SCD, can help by reducing fermentable carbohydrates that bacteria feed on. Probiotics. Some studies suggest that specific strains of probiotics can help restore a healthy balance of bacteria in the gut. Digestive enzymes. These can aid in digestion and help reduce symptoms by ensuring food is properly broken down and absorbed. Lifestyle changes. Reducing stress and incorporating regular exercise can improve gut motility and overall digestive health. Speaking of studies, let's highlight a couple of scientific studies that have provided insights into SIBO and its treatment. One notable study published in the journal Gut and Liver in 2010 investigated the efficacy of rifaximin in treating SIBO. The study found that rifaximin significantly reduced bacterial overgrowth and improved symptoms in patients, demonstrating its effectiveness as a treatment option. Another study published in Global Advances in Health and Medicine in 2014 explored the use of herbal therapies. The study concluded that herbal treatments were as effective as rifaximin in treating SIBO, providing a viable alternative for those looking for natural treatment options. These studies highlight the importance of exploring both conventional and natural treatments to find what works best for each individual. It's essential to work with a healthcare provider to develop a personalized treatment plan. Now, as promised, here are some herbal remedies for SIBO. They have gained popularity as natural alternatives to antibiotics. These herbs possess antimicrobial properties that can help reduce bacterial overgrowth in the small intestine. Here are some of the most commonly used herbal remedies. Oregano oil is known for its potent antibacterial, antiviral, and antifungal properties. The active compound, carvacrol, has been shown to be effective against various strains of bacteria. Typically, oregano oil is taken in capsule form. The dosage can vary, so it's important to follow the guidance of a healthcare professional or the product's instructions. Berberine is a compound found in several plants, including golden seal, barberry, and Oregon grape. It has strong antimicrobial properties and has been shown to be effective against a wide range of bacteria. Berberine is usually taken in capsule or tablet form. Common dosages range from 500 milligrams to 1,500 milligrams per day, divided into multiple doses. Garlic contains a compound called allicin, which has powerful antibacterial, antiviral, and antifungal properties. Garlic supplements are often standardized to contain a specific amount of allicin. Garlic supplements, specifically those standardized for allicin content, are commonly used. Dosages can vary, so it's best to follow the product's instructions or consult with a healthcare provider. Neem has long been used in traditional medicine for its antibacterial, antifungal, and anti-inflammatory properties. It can help combat bacterial overgrowth in the small intestine. Neem is available in capsule, powder, and tincture forms. Dosage instructions vary depending on the form, so it's important to follow the product's guidelines. Grapefruit seed extract is known for its broad-spectrum antimicrobial properties. It can be effective against a wide range of bacteria, fungi, and viruses. Grapefruit seed extract is usually taken in liquid or capsule form. The dosage can vary, so following the product's instructions is recommended. Thyme contains thymol, a compound with strong antimicrobial properties. It has been used traditionally to treat various infections and digestive issues. Thyme can be used in the form of essential oil, capsules, or as a tea. The dosage depends on the form used, and it's best to follow the product's instructions or consult with a healthcare provider. Pau d'arco is an herb derived from the inner bark of a South American tree. It has antimicrobial and anti-inflammatory properties that can help reduce bacterial overgrowth. Pau d'arco is available in capsule, tincture, and tea forms. Dosages vary, so it's important to follow the specific product's guidelines. Golden seal contains berberine and has strong antibacterial properties. It's often used in combination with other herbs for its synergistic effects. Golden seal is typically taken in capsule or tincture form. The dosage can vary, so it's best to follow the product's instructions or consult with a healthcare provider. Although these herbs have been found to reduce small intestinal overgrowth, there are a few things to consider. Always consult with a healthcare provider before starting any new herbal remedy, especially if you are taking other medications or have underlying health conditions. Use high-quality, standardized herbal supplements from reputable sources to ensure efficacy and safety. Follow the recommended dosages on the product labels or as advised by a healthcare professional. Overuse of herbal remedies can lead to adverse effects. Sometimes herbal remedies are used in combination to enhance their effectiveness against SIBO. For example, a combination of oregano oil, berberine, and garlic may be used under the guidance of a healthcare provider. Here are some additional tips for managing SIBO. Work with a dietitian to create a meal plan that avoids trigger foods and supports gut health. Stay hydrated and consider drinking bone broth, which can soothe the gut lining. Avoid snacking between meals to allow the gut time to cleanse itself. Consider taking a multivitamin to address any nutritional deficiencies. Living with SIBO can be challenging, but with the right information and support, it's possible to manage and even overcome it. Remember, it's important to consult with your healthcare provider before starting any new treatment or diet plan. Thanks for watching. If you found this video helpful, give it a thumbs up and share it with anyone who might benefit from it. Don't forget to subscribe for more health tips and information. Until next time, take care and stay healthy.